Hi, in this video, we'll be talking about the chairside zirconia workflow. At this point, you would have completed your preparation, finished your scans, and identified your margins. Next step is to design your crown. After making sure the contours and contacts are correct, proceed to fabrication. Proceed to manufacturing and make sure that the sprue does not exit out of an interproximal contact area. Top right corner, make sure to select the zirconia mill. Press Start to send the case to the mill. You'll be prompted to enter the block-specific code either at the computer or at the mill. Make sure the block is fully seated and screw it down until you hear an audible click. The milling process starts and will take about 15 minutes to complete. After milling is complete, remove your milled block from the milling machine. Use a straight burr on a straight handpiece to remove the sprue from the crown. Remove any visible remnants of the sprue from the crown with that same burr. Pre-polish the surface of the crown and avoid pre-polishing the proximal contact areas. At the speedfire furnace, select your patient's name and insert your crown into the speedfire. After it's done curing, wait for it to cool down before touching it and removing it from the furnace. When the crown has cooled down sufficiently, you may try it into the patient's mouth, confirming your occlusal contacts, proximal contacts, and margin. Back at the lab, use a sandblaster to sandblast the inside of the crown. You may also polish the outside of the crown to a nice opal finish. The next segment goes over the steps needed to bond the crown to the tooth. For this, you will need IvoClean, Monobond, resin cement, microbrushes, and a dappen dish. Apply IvoClean to the intaglio of the crown and agitate for 20 seconds. Rinse. Follow that with a 60-second application of Monobond. Apply a thin layer of cement in the intaglio of the crown. Cement the crown. Confirm full seating with a radiograph. Please note that techniques and materials change over time, so make sure you're up to date with the latest manufacturer instructions.